I was 30, beautiful wife, two beautiful kids, new job, on the career, on the climb, everything's going well. And this is not something that happens to, well, to me.
Anything in my life that I thought was important at that point just fell by the wayside.
First of all, it's absolutely terrifying. I've got cancer, you know, and not only just cancer, brain cancer.
Brain cancer. It affects approximately 35,000 Americans each year. It's a cancer so mysterious, doctors and researchers don't know what causes it, and they don't know how to cure it. Welcome to the Cutting Edge Medical Report. I'm Nancy Dewar. The brain is the most complex organ in the human body, but little is known about it, which makes finding a cause and a cure for brain tumors very difficult. Just ask David Bailey, a musician from Virginia, who was diagnosed with a brain tumor at the age of 30. He had a wife, 2 young children, and a promising career ahead of him, and this was the last thing David expected.
That first delivery of the news was very numb, just very, let me process this in a while, because I don't even really understand.
It all started 4 years ago when David began having severe and violent headaches. One night his headache got so bad he had to be rushed to the emergency room. Doctors were forced to operate immediately.
One doctor this is the moment that I remember, he leaned over and he said, "David, do you know why you're here?" "No." "Well, you're here because you had a brain tumor in your head, and the doctors operated and they took it out. And it was very large, it's about the size of a baseball."
David's operation was successful, but his long-term prognosis did not look good.
The bad news is we've done the pathology on this. And the good news is we think we got most of the tumor, but the pathology says that it's grade 4, it's called a glioblastoma, and the statistics are not good. Probably a year, 6 months if you do nothing, a year if you treat, and if you're going to live farther than that, it's a 1 to 2% chance that you'll live beyond that.
David's wife, Leslie, prepared herself for the worst.
Then a nurse came up to me the day I was taking him home, and she told me, she was very kind, but she said, "Let him do whatever he wants, because he doesn't have much time." I was crushed.
But David refused to accept the negative news and went in search of help. Through the internet, his search led him to the brain tumor experts at Duke University Medical Center and to Dr. Henry Friedman.
With David, he was a very articulate person who clearly had already started to do a lot of research about the nature of his problem and asked us how we would treat him. And we said that we, one, would treat him with the intent to cure him, and B, we would like to look at his scans and his slides and his records, the usual material that introduces him to us in a medical fashion as opposed to a personal fashion, and that once we have that information, we would be able to be more specific, but we guaranteed that we would offer him hope and help in some fashion.
But even though Dr. Friedman was able to offer David and his family hope, the life expectancy for a person with a brain tumor isn't very long.
The average life expectancy of a patient with a very malignant brain tumor with radiation therapy and chemotherapy is still less than a year.
Keep in mind, not all brain tumors are life-threatening. There are benign tumors that need little to no treatment. But it's important to know what is benign and what is malignant.
Some tumors in the brain have a very benign course and can be cured, such as meningioma, for instance, which can be completely removed surgically and may never influence that patient's life again. Other tumors are very highly malignant, very cancerous tumors that are very difficult to control, like the glioblastoma. And then there's a whole variety in between.
To understand how brain tumors occur, it's important to understand how the brain works.
Well, there's no question we all desperately want to cure this disease, and I think that the biggest breakthrough is going to come in our ability to go backwards in time and understand much more about the developmental biology of the brain. If we understand how these cells come to be and form the brain, then we will understand perhaps the mysteries that revolve around how these cells convert to malignant brain tumor cells. Because once they become malignant, we don't have the effective strategies in this day and age to cure the problems.
The brain weighs 3 pounds and is arguably the most important organ in the human body. It controls all bodily functions, physical and emotional. A tumor, depending on its location, could damage a variety of everyday functions, from motor skills to senses.
If the tumor is involved along the area of the brain that is involved in motor function, then when you get a tumor there, the patient may experience weakness of one or more part of one side of the body, depending on what side of the brain is involved. If the patient has a tumor that is involved in the temporal lobe over here, then they may have symptoms that are involved with memory or temporal lobe seizures where they smell something that's not there, or they have an aura of some kind or something that's not really there. The tumor could arise in the back of the brain, in a part we call the cerebellum. And the cerebellum is involved in the ability to walk in a normal fashion, to be able to do fine motor function.
But when something goes wrong with the brain, there aren't always many options. We'll continue with David's search for treatment and meet a woman determined to beat the odds and live a full life after brain cancer. Stay with us. The Cutting Edge Medical Report will be right back. This is Johanna McKenna. She's a graduate student at the University of California at San Francisco. Cafe on the corner. And also a singer. And she's a brain cancer survivor. 4 years ago, Johanna began experiencing violent headaches. That's not uncommon in a fast-paced society, so the doctors first attributed them to stress.
I had a physician at the time who asked me one question and one question only, and that was I stressed? In the middle of December during the holidays, everybody is stressed, but I don't know that everybody gets dizzy. And in April of '95, I decided to try antidepressants because my mood was just not improving. And within a matter of days, I began to get extremely violent headaches. And they would wake me up out of my sleep. I would think that Excedrin or something would help. Nothing helped.
So Johanna went back to the doctor.
As I lay on the table, the technician said, "There's something showing up in your scan. We want the neurosurgeon to look at it." At 6 o'clock, she sat me down in her office and said, "I wish I had better news. You have a brain tumor." I was 26 years old. That's not what I expected to hear.
Johanna was immediately scheduled for surgery.
They told me on Friday, September 8th, that I had a brain tumor, and on Tuesday the 12th, I was in surgery.
Johanna's tumor was removed, but several months later, there was a recurrence.
There was a second surgery 7 months after the first. I had radiation therapy through mid-December of 1995 and began chemotherapy, and within 2 months of being on that therapy, I was told to discontinue it because they found that my tumor had returned.
It was now time for Johanna to look for something different.
Johanna would eventually find a clinical trial for a new treatment for brain tumors, and we'll continue with her story in a moment. But first, let's take a closer look at the symptoms of brain tumors and what researchers believe may cause them.
Although all brain tumors are different, common symptoms include headaches, seizures, and mental and behavioral changes like difficulty with memory and speech, or changes in temperament and personality.
There's no ability of the brain to regenerate itself. Although there can be some relearning, and rewiring, I guess. In most cases, where there's a loss, it's a permanent loss. The other part of the brain is that there are so many functions associated with the anatomy that you could lose the function of an arm based on the location of the tumor, or prevent the surgeon from removing that component of the tumor because of loss of function. So there are many limitations to what we can do.
Even though symptoms can result in a diagnosis, scientists are far away from explaining the cause.
No one really understands yet what causes brain tumors. There are certain things that we know seem to be associated with it. If you get radiation therapy for something to your head, you certainly have a risk of developing a brain tumor years down the road. Children who get skull fractures are more likely to develop a brain tumor called meningioma. But in general, we don't know.
Many studies are underway to identify the possible causes of a brain tumor. The two main areas of investigation are genetic and environmental. Genetic factors include gene alteration, which is an unexplained change in a person's DNA that results in cancer. Another genetic factor is heredity. Brain tumors, like many other cancers, can run in families. Researchers are looking into possible environmental factors that can be divided into two categories, either physical or chemical. Physical agents are low-frequency electromagnetic fields emitted by power lines and cell phones. The research into whether there is any connection here is ongoing. Also, brain tumors have been known to occur in people regularly exposed to chemical agents, such as formaldehyde, pesticides, crude oil, or petroleum-based products. But most of the time, there is no concrete link. The tumor seems to come out of nowhere.
There's no one area of the population that's affected, except for the observation that as our population is aging, we're seeing a higher number of cases of patients who are older, in their 70s and their 80s. And that seems to either suggest some environmental association, perhaps, that's causing those clusters, or it's just because the population is aging and they're more susceptible.
Doctors say until they know the cause, it will be difficult to find a cure.
I think that you could look at cancer at the present time as sort of a jigsaw puzzle. And if you've ever done a large jigsaw puzzle and not seen the picture, initially the going is sort of slow in that, you know, well, this piece and you have, 1,000 pieces sitting there. And then you sort of figure out the strategies and you start seeing part of the picture, and then things go much quicker. And I think we're sort of at that stage right now.
Up next, find out about new treatment options. Plus, we'll meet one member of a famous family who used his experience to draw attention to this potentially deadly disease.
And now, ladies and gentlemen, the Osmond Brothers.
If you were around in the 60s or 70s, you remember the Osmond Brothers and their brother-sister team, Donnie and Marie. A few years ago, one of the Osmonds, Wayne, was in the news when he was diagnosed with a brain tumor.
It was shocking, but yet it wasn't, because I knew I had a problem, since the day that I married my wife.
That's when Wayne moved into what's usually the first phase of the treatment process, surgery.
Alan Friedman, he only gets his Sundays off, and he gave up his Sunday for me. The only day of the week he gets off. And just because I was in such dire need of this operation, and he was great. And you want to go to that very best person, so you will allay your fears of getting your head cut open.
The goal of surgery is to remove all visible tumors.
Well, I think surgery is probably the most important part of the therapeutic regimen in this day and age. It's the only way to immediately and effectively improve the quality of life of a patient. It's also the only way to immediately reduce the overall size and bulk of the tumor.
One new medical breakthrough, which has increased the success rate of surgery, is brain mapping. Mapping tools can improve the safety and effectiveness of surgery by locating the tumor and avoiding critical areas of the brain during the operation.
The brain, except for some of the blood vessels, has absolutely no pain sensation. So you can take a patient who has a large tumor that might be getting close to critical areas of the brain, put the patient to sleep temporarily to open up the skin or remove the bone, and then have the patient awake in the operating room and electrically find out exactly where these critical areas of the brain are. What this allows you to do is very confidently remove as much of the tumor as possible and putting the patient as little risk as possible.
Even with new techniques, the idea of brain surgery can be very frightening to a patient and his family.
Mentally processing the idea of somebody cracking the skull open, it just isn't, you know, a guy like me, just doesn't make any sense. It doesn't compute, and it's not a pleasant topic.
Many benign tumors are treated only by surgery. Most malignant tumors require additional treatment. And radiation therapy is often the next step in battling the tumor. But there are often side effects.
I was told that I may lose my hair. And one day, indeed, that happened. And I woke up and scratched my head and pulled out a whole tuft of hair, and I laughed. I laughed very, very hard because they told me this would happen. I didn't believe them.
Johanna's hair grew back, and fortunately, there are medications that can help alleviate side effects of radiation and make it easier on the patient. Another treatment option is chemotherapy. When we come back, we'll tell you about a new form of chemotherapy, which is helping patients live longer and happier lives. Even after surgery, David and Johanna both had to look for other treatment options.
Through their research, David and Johanna found out about a clinical trial involving a promising new form of chemotherapy called Temodar.
In the last decade or so, temozolomide has evolved as a very promising new agent that doesn't seem to have the same resistance as other drugs do. And it's been the most significant advance in chemotherapy that we've had in at least the last 5 years.
Temodar is the first anti-tumor agent or chemotherapy agent to be approved for the treatment of patients with brain tumors in almost 30 years. From the standpoint of an oncologist, it's a delightful drug, easy to give, doesn't make the patient sick, works.
It worked for David.
Just the word chemotherapy, the fear of the unknown was huge. And here was this drug, which was a pill, which I could go home and take. And all of a sudden, my images of being strapped up into a bed in a hospital for hours and hours and days at a time, with my hair falling out and looking like a mess. And, all of a sudden, there was a sense of dignity.
And for Johanna.
This treatment was all pills. There were no injections involved. And I went to work 6 weeks after the second surgery. It was far less invasive than the first. And I worked full-time while taking the chemotherapy.
Temodar comes in pill form and is taken orally for 5 consecutive days each month. It works like most anti-cancer agents do, by interfering with the tumor cell's ability to divide. Side effects include nausea, vomiting, and a lowered blood count. But Temodar isn't the only thing credited with saving these people's lives. Foundations like the American Brain Tumor Association offer websites and other resources to patients and their family members.
We are interested in providing a host of patient services. The patient educational materials we provide is crucial to individuals, to patients and their families who are going through this disease process.
While foundations like these certainly can help, patients often discover a spiritual dimension that gets them through every day. David found strength through his music.
Way beyond the now, into the not yet.
One of the greatest joys I have is when somebody writes me and they'll say, I listened to your song. You touched my heart. You made me cry. You put into words everything that I felt, and I can't find any way to express. You did it for me. Thank you. And one person at a concert tells me that, then I'm happy.
Wayne and Johanna each turned to their faith for support.
What really got me through everything is, I believe, in my strong faith in God. And I really felt that my time was not up yet.
There is a way around this, and whether you call on God or another higher power, there is a way. There is definitely a way, and you will get through this.
Today, David, Wayne, and Johanna are all cancer-free.
Take more time for myself and to be with my wife and my kids and enjoy them more. And not be uptight. Don't let life affect you.
Wishing I could wish this life would find a way.
If anybody had told me years before that what was forthcoming, I probably would have run for the hills. I think that's what partially gave me the strength to deal with it, is that I had no clue what was coming. In a situation like that, you have to muster the strength, and that's what I did.
I hope to continue to be what I believe is in God's will for my life. And maybe most of all, I hope to be a dad and a husband until the day I die.
Hallelujah, you got one more day. Hallelujah, you got one more day.
That concludes this edition of the Cutting Edge Medical Report. If you'd like more information on brain tumors, please stay tuned. I'm Nancy Dewar. Join us next time we explore the fascinating world of health and medicine. If it's on the cutting edge of tomorrow's health care, we'll bring it to you today.
Up to the mountains, have a picnic with my kids and with my wife. But hike the hidden trails, I'd tell a few tall tales about the crazy moments